Hyperparathyroidism can happen for a lot of different reasons, but essentially you have too much PTH in your body. So you're probably going to take an inhibitor of that, and the inhibitor can cause too low of PTH in your body. So make sure to educate your patients on different signs and symptoms and how to report hypoparathyroidism. And you'll also want to consistently check their serum levels to see if they still have too much PTH. And if they do, you'll want to encourage them to avoid certain calcium-rich foods, antacids like Tums, certain vitamins. Those can all make it really hard on the body. You can try encouraging them to drink plenty of fluids. That'll help with renal filtration and help reduce any kidney stones that are forming in there as a result of the calcium. And since it is quite an adjustment with all of your activities changes and all the foods that may be changing, and especially any differences in mood due to calcium imbalances, you'll want to encourage maybe some psychological support groups or even activity groups like walking groups. That can be very helpful and lessen a lot of the symptoms and signs that can be associated with that and too much or too little of that hormone.
Hypoparathyroidism. Hypoparathyroidism is a diminished concentration of parathyroid hormone in the blood, which causes deficiencies of calcium and phosphorus compounds in the blood and results in severe muscle spasms. This occurs when the glands produce too little PTH in your body, the blood calcium level falls, and the phosphorus level rises. With patients, it is good to monitor the serum calcium level, which should stay in a good reference range of 4.5 to 5.5 milligrams. Be sure to assess and educate your patients how to recognize signs and symptoms of this possible illness, which would be tetany, muscle spasms, muscle cramps, twitching of the mouth, tingling or numbness of the fingers and toes, carpal tunnel spasms, spasmodic contractions, abdominal pain, cataracts, decreased consciousness, dry hair or dry skin, pain in the face, legs, or your feet, seizures, and even possible issues with your teeth. Treatment involves calcium carbonate and vitamin D supplements. These usually must be taken for life if you do have hypoparathyroidism. Blood levels are measured regularly, as we said before, to make sure that the dose is remaining correct. A high calcium, low phosphorus diet is also recommended for your patient. You could also do PTH injections, which should be administered in the thigh, alternating legs for each dose, to ensure your patient has the competency as well as the confidence of self-administering these injections before you send them home with this kind of medication. It is best to call your healthcare provider if you develop any symptoms of hypoparathyroidism, but if you experience seizures or breathing problems, be sure to let them know to call 911 right away, as this is a more serious effect.
Hi, my name is Carly. I'm going to be the nurse taking care of you today. How are you feeling?
Just a little dizzy. Head doesn't feel very good.
Yeah, well, let me just take your pulse. Okay, let's do your blood pressure. Can you tell me, have you been having any issues taking your medication?
No, I haven't been taking it actually.
Is there a reason why you stopped taking your medication?
Well, I don't like the way it makes me feel.
Well, let's check your blood pressure here. Yeah, you're showing to have a really low blood pressure. And when you stop taking your thyroid medication, which is designed to reduce your metabolism, help get everything going how it's supposed to be, when you stop taking that medication abruptly, it can cause some unwanted symptoms such as the lightheadedness you're feeling, the low blood pressure, the slowed pulse, your respirations are really low, which can cause myxema, which is going to, the depression of the central nervous system is something that we really need to be cautious for. And, you can never stop taking your medication abruptly. That's causing these issues. So I want you to start taking your medication again. It's important that you take it at the same time every day. So if you need to set an alarm on your phone, whatever you need to do to make sure that you remember to take your medication at the same time every day, because we don't want this to happen again. Do you think that's something you can do?
Yeah, I suppose I can make it.
All right, and if the medication is still making you feel, kind of funny, maybe we can switch to a different thyroid medication that's going to help you and make sure you continue to use it every day. But maybe try setting an alarm and see if that'll help, okay?
Okay.
All right. Thank you.
For hypothyroidism, levothyroxine or Synthroid is the preferred treatment. It contains synthetic crystalline, which is the synthetic version of the hormone that's produced by the thyroid gland. It can increase anticoagulant effects, so encourage fall safety precautions. Educate pre-diabetics and those with diabetes that there's an increased risk for hyperglycemia. You want to caution patients to avoid certain foods that increase thyroid secretion, which would be strawberries, peaches, pears, cabbage, turnips, spinach, kale, Brussels sprouts, cauliflower, radishes, and peas. Absorption of the drug is slowed down by food, so taking it before breakfast in the morning is preferred. Also, taking supplements that contain calcium, iron, magnesium, or zinc should be avoided because it binds to the medication and slows down the absorption.